Welcome back to the show. If you struggle with carpal tunnel syndrome, this segment's for you. Join us now is Dr. Kathleen McKeon with the Andrews Sports Medicine and Orthopedic Center. Good morning.
Good morning.
So tell us, what is carpal tunnel?
Carpal tunnel syndrome is a condition where one of the main nerves that runs to your hand has too much pressure on it. It's essentially a pinched nerve at the wrist.
And it causes a lot of pain from what people tell me that have had it.
It does. It causes pain, numbness, kind of that burning nerve type pain, typically in the thumb, index, and long finger. And in severe cases, it can even cause weakness and trouble manipulating small objects.
And I would think that these are the three of the digits that we use the most.
They are, absolutely.
Depending on which hand they're on.
Exactly.
What are some of the causes?
We often don't know the exact cause in most patients. There are a lot of risk factors that are associated with developing carpal tunnel syndrome, but in most people we don't know the one specific cause.
Okay. So let's say I start to feel the numbness or whatever. What do I need to do to make it feel better?
There's lots of things we do, and we always start with non-operative treatment. So wearing a brace in your wrist is often very helpful. That nerve is pushed on more when your wrist is bent all the way back. So wearing the brace forces you to keep that wrist pretty straight and relaxes that nerve as much as it can. We usually have people sleep in those braces at night, and that can really help that nighttime waking and waking up with that painful burning in the hands.
If I don't get it fixed or remedied, what are some of the risks associated with carpal tunnel syndrome?
If you let it go too long, you can have some permanent damage to that nerve that is irreversible. That's typically happens if you wait until your hand is numb at all times. So if your hand is numb all the time, then you've waited too long, and there could potentially be some permanent damage to that nerve.
Because you were saying before we went on that you can actually have surgery in extreme cases.
Yes, you can have surgery, and it's actually a fairly common surgery to have done. The good thing about the surgery is that it's fairly quick, it's fairly straightforward, and it's fairly reliable to fix this problem. So if you have to have a surgery, this is a good one to have. But like I said, we always want to start with non-operative treatment measures first before we turn to that.
Let's say you start to feel some of those symptoms. At what point should you say, I need to go see a doctor?
If you have numbness, tingling, burning type pain in your hand, particularly if it wakes you up from sleep at night, and particularly if it happens more than a couple times a week and it's been going on for a few weeks, that's a sign that you really ought to be evaluated.
And I would think for people who have jobs where they have repetitive movements, that it could really affect them at work.
It can, and that's one of the common misconceptions about carpal tunnel is it's not actually caused from typing, although certainly typing can make it feel worse. People who have jobs where they use vibratory tools like jackhammers or chainsaws are definitely at higher risk for this.
I didn't know that.
And people who work like in factories on the line or things like that, repetitive things like you said.
Now, I know that you can go to a store and buy a brace, but should they see a doctor before they buy one?
It depends on how severe it is. Like I said, if their symptoms are intermittent, it's not been going on for very long, buying a brace over the counter is a very reasonable first step. If the brace really isn't cutting it or making them feel better, or certainly if their symptoms are more often or have been going on for a longer time, they should go see somebody.
And if they want to see you, how can they do that?
They can get in touch with us. They call the Andrews Sports Medicine Orthopedic Center number, which is 939-3699.
939-3699. You can also go to andrewsportsmedicine.com, and when you do, you'll be among some of the most elite clientele on the planet. So give him a call today. Thank you so much.
Thank you.
Nice to meet you.
You too.